While they do, I'll introduce myself. I think I know many of you. My name is Vicki Austin. I'm a co-founder of Global Disability Innovation Hub with Cathy and Iain and others. And I'm also an Associate Professor of Social Justice and Innovation here at UCL. And it's our pleasure to close the first day's session after such a wonderful and vibrant first day, if somewhat challenging due to technical issues, with a session that actually really focuses on what works and what doesn't work, which feels appropriate. So let me first of all ask my colleagues to introduce themselves very quickly.
Hi, excuse me, I'm Anne McKinnon. I work for FCDO and I lead on the AT 2030 project for FCDO. That's the Foreign, Commonwealth and Development Office, so the UK government.
Good afternoon, everyone. I'm Diane. I work for GDI Hub as Director of Programs, leading the implementation of AT 2030. And I have the people that I sort of do a lot of reporting into on my right-hand side. Lovely to be here with you today.
So we're going to have about 27 more minutes with you today before we'd invite you to go upstairs for a drink. So let's think first of all about what we've learnt along the way on our journey. I'm going to talk mainly around AT 2030, which is our flagship programme, sponsored by FCDO and operational since 2018. So far, the programme has reached 29 million people in 60 countries with 70 partners. We've written about 150 papers, about half of them published in academic journals, and published 23 case studies and 20 life stories, as well as 5 product narratives, lots of specifications and procurement guides, and developed strategic tools which have been used in many countries, including 15 country capacity assessments. The innovative service delivery models that we've developed as part of the programme have been as important as the products that have been supported to scale, both the 31 AT ventures and the 11 on track to scale. And as I think today has demonstrated so beautifully, the work we've done alongside our partners in 6 cities around the world has been really transformative in understanding the way that the built environment enables assistive technology to be useful. It's our pleasure today to reflect on our personal stories, I guess, and our thinking through the years, and mostly joyful years they've been. And I guess for me then, I'll start by sharing what we found when we looked overall at the programme. We found that data and evidence are really still very foundational to impact. And I think Jamie sold that to us really well this morning. We found that disruptive partnerships are actually really important. And I love the fact that Frey was talking about Lego, a company that makes toys, now in the AT space. It's exactly the type of disruptive partnership that needs to take place. We have talked about the tools that are needed to strengthen systems, and Kylie's amazing description of the work ongoing in countries around the world, including in, I think, one new crisis context since this morning, is just an example of why those tools and mechanisms are so necessary. And we've seen that cities have the opportunity to drive change, and the shocking fact that Michaela shared, about 60% of the built environment in the world is not yet built, that will be in place by 2050, tells us everything we need to know about why that's important. I loved Cathy's reflection on how mobile phones can change lives in Kibera this morning. And so we know that mobile as AT is important. We also know that some ATs will never scale. You know, what works in some cases is repairability, bespoking, local production, not scaling AT. And we need to own that too, right? It's not always possible. And finally, I think with the investment space, patient capital, we need partners who are willing to invest and give it time for the market to respond and grow and change and build that momentum. And I'm delighted that we have some of those partners in the room. It's also probably my favourite session was the funny one, as always. But you know what really doesn't work? just like loads of devices by themselves. That doesn't work. We can't just buy loads of AT and ship it around. That's not a solution to long-term systemic change. So the same old service delivery models, they're not going to work in the long run. We need to be able to do eye and ear scans with mobile phones. We need to be able to understand what tasks can shift to community health workers. We need to think again about what digital production and manufacture can do to our service delivery models, like Koala reminded us today. And what also doesn't work is stuff that doesn't engage users. I'm not going to say more, because I think Anna and Cathy said it all. Tariffs are still on AT. So countries are charging each other to export and import assistive technology. That doesn't really work. Maybe it works for the Exchequer, but I don't really think so, because then we have to invest in AT in a different way. So I'll put my political hand up and say that doesn't work. Joylessness, that doesn't work. I'm going to say more about that in the morning. But doing work relentlessly in a way that breaks ourselves and others, it doesn't work. And also, doing it by ourselves does not work. If any one actor could have done this, it would be done. And so, again, like Kylie said this morning, we need to each lead on the things that we're really good at and support others to do the stuff that they're really good at. I'm going to say more about what's next at the end, but first of all, I'd love to turn to my colleagues and offer the microphone to hear from you.
Thank you, and hello again to everyone online. And good evening to, or good afternoon to those of you in the room. I'm going to take just a short journey through, take you on a short journey through AT 2030. So back in 2018, at the Global Disability Summit, which was held just up the road, the GDI Hub, GATE Initiative, CHAI, Leonard Cheshire, Motivation and UCL presented FCDO with a scoping paper. Now, the scoping paper was about 123 pages long, if I'm not wrong, but an incredibly detailed picture of how we could tackle access to AT in developing countries. It had several recommendations, two of which were 2 new programmes. One programme would generate evidence, research and insights into what works. We now know that is AT 2030. And the other would create a global partnership. We know that now as AT Scale. So from there, a £10 million AT 2030 programme was born with 100% match funding from our partners. So I thought, in the 5th year of the programme, that I'd just talk about some of our achievements. Now, I quite deliberately haven't picked the biggest or the best known. I've just picked a couple of selected, I guess, some of my favourites, but don't tell the rest. As market shaping has been used in other sectors, like health, we believed similar approaches could be used for AT. So we created 5 product narratives, as Vicki mentioned, to inform our approach to market shaping for assistive tech. How could we leverage the capabilities and resources of public, private and, I nearly missed a card there, and non-profit sectors? That might have been a disaster. To harness innovation and break down barriers, and that's what the product narratives gave us a map or a guide. Then, in 2019-20, we conducted some early studies of mobile phones as assistive tech, building data and knowledge on how people with disabilities use their mobiles, the services they use, and the barriers they face. And around about the same time, GDI Hub, working with AT 2030 and working with GSMA, who are the association who bring together mobile carriers from around the world, work together to better understand the mobile disability gap. And a few years on, a few programmes in between, we're now working on a project with Google on on mobile phones by providing mobiles to people with disabilities who need them as AT or assistive tech. So, where are we? We're about 2019 now, already demonstrating impact and promise. In the middle of the year, in 2019, FCDO decided to double AT 2030's funding to £19.8 million. So I'm going to take you. So I'm going to talk about another highlight, and this is about some unexpected results we saw from a project that Motivation ran. So they had a very user-centred approach, and they used this in their wheelchair study in Kenya. What they found was, over and above the technical specifications around wheelchairs, what works, what doesn't, what they found was that being listened to by clinicians gave users a real sense of confidence and self-worth. Learning about their wheelchair, about the kind of seating cushions, how the back should be set, learning about the wheelchair really encouraged and enabled the users to think about their own needs. What do I need out of this? And through learning about their wheelchair and how it should be set up, users could then advocate for better services in their communities. So we move through to 2021 now. Shujaz, a multimedia platform that aims to improve the lives and livelihoods of young people in East Africa, completed a one-year-long study and published a report. What they had done is run a targeted media campaign to address young Kenyans' attitudes and perceptions. So these are people aged between 15 and 24. So looking at their attitudes and perceptions towards people with disabilities. And I was really fortunate enough to meet the Shujaz team in Kenya last year. And it really felt like you were sitting in an incredibly creative space. I'd heard them present the report online to us. It was impressive. But to sit in the same room and have a full discussion and kind of better understand how passionate they were about the social issues they were targeting, it really was fantastic. It kind of blew me away. The AT 2030 project with Shujaz aimed to break down barriers that people with disabilities face in their communities. They used a national media action research campaign that included social media, engagement, text messages, and stories in their comics. To me, it just felt like a really different and refreshing way to analyse and address young people's attitudes and perceptions. To me, it was a really innovative and inspirational approach, highly impactful, reaching over 11 million young people, either directly or indirectly. I mean, I could go on probably for days about country capacity assessments, rapid AT assessments, inclusive infrastructure, which we heard about earlier, or talk about parasport against stigmas, education and media campaigns, local circular manufacturing. Okay, I can talk for days about local circular manufacturing. And of course, Innovate Now, the AT Impact Fund, which I think we're going to rename the AT Growth Fund.
Yes.
Oh, maybe
Big
that
reveal.
was to be announced. And our input to the global report on assistive tech.
Ooh.
And I'm still only scratching the surface. So why am I sharing all of this with you? Well, as partners and friends of AT 2030, we've come a long way in 5 years. We've directly reached nearly 9 million people and raised over £15 million in match funding from our partners. We have, and these numbers I'm about to tell you are hot off the press, conducted 15 AT country capacity assessments, supported 11 new assistive technologies and 9 service delivery models on track to scale. We have supported 31 AT ventures to become sustainable, published 70 peer-reviewed journal articles and 92 influencing papers, and 47 organisations or country governments are actively implementing AT 2030's ideas, which I think is absolutely incredible. So, with all that in mind, earlier this year at COSP in New York, FCDO announced a further £31 million in funding for AT 2030. So from a £10 million programme a few years ago, AT 2030 is now a really strong £50 million programme. And if you include 100% match funding, as Cathy said this morning, it takes you up to a programme worth £100 million. So I just wanted to say to people online, to people in the room, a massive, massive thanks to GDI Hub, to all our partners, supporters and friends. We really can start to move mountains if we work together with a common aim. So all the very best going forward. I can't wait to see what the next 5 years brings. Thank you. Woo.
Thank you so much, Anne. Over to Diane.
Can't decide if I need my assistive technology or not. Thanks very much. Good afternoon, everyone here and online. It's really wonderful to share a little bit with you. I think what I did not mention earlier was my grateful thanks to my amazing team that helps me in many, many ways in terms of the implementation and the leading of AT 2030. So thank you so much. And massive thank you to Anne and the team, but especially today for setting up for what I want to share, and to Vicki, because you've kind of painted the big picture, and I had to kind of select something that was really meaningful to me because I'm across the program and I think it's all awesome. So it was rather difficult. I don't know if you've heard or realized from the accent, but I'm not British. So I live in Cape Town in South Africa. I'm also the mother of one child, Jodie Lee, and she is my daughter who was born with a profound bilateral sensory neural hearing loss 31 years ago, and that was my introduction to disability. What AT does she use? Well, AT in South Africa, you know, beyond hearing aids and cochlear implants is a little bit limited, but essentially her go-to AT are her 2 implants. She had hearing aids before that. She was only implanted as an adolescent. She uses live captions via AI for any kind of online calls because she's busy studying her PhD. She uses her mobile phone as AT all the time. So I have worked or I have volunteered in the disability sector, and more particularly in the hearing side of the disability sector, to create change for more than 30 years, both in my own country and globally. Have I achieved what I set out to achieve? Certainly not. Change has been slow. We've done a lot, but there's so much more to be done, and we've heard many people say that today. And I'm reflecting what Frey said this morning. He said, we want some joy. And I know that, you know, Vicki said we're also going to talk about joy tomorrow. So I'm going to share some personal information with you and stories, but I'm also going to share some programmatic stuff with you that relates specifically to hearing loss. But it's also joyful because we've done stuff that matters and that can change and has changed the world. So the focus, obviously, what I'm going to share with you is around hearing assistive technology and what works. I'm going to share 3 important examples from 80-20-30 with you. And the first has already been referred to, and that was the product narratives. And the one that I'm going to zoom in on is on hearing aids, because it speaks to hearing aid provision in low and middle income countries, and that it's really of critical importance as a strategic tool, the product narrative, to develop and shape the market, which really needs hearing aids, needs affordable hearing aids, them to be available, and as well, the services to be of optimal quality. We know that globally around 466 million people currently have a disabling hearing loss. And that's about to double by 2050. So we're in a little bit of trouble around, access to hearing aids. If I just look at South Africa, 1 in every 16 babies are born with a hearing loss. And we have no newborn hearing screening programs mandated in the public healthcare system, and it has to be requested in the private healthcare system. And we also know that most people with a disabling hearing loss live in the developing world and do not have access to hearing AT. So what really drives me to change this situation is more than the burden of cost and the lack of access, but that unaddressed hearing loss also has a negative impact on the individual's education, their social life, their family and community, their independence, their psychological well-being, as well as their employability. It's far-reaching. So what have we really learned that works to help develop the market for hearing aids in low and middle income country settings? Firstly, we need to strengthen global policy guidance around service delivery standards, and there's some work that's already been spoken to about that. Product selection and product quality needs a focus. Secondly, we need to support governments to strengthen hearing aid provision, including demand generation and investment in service delivery capacity, government purchasing and procurement support. And of course, innovation plays into all of this. Thirdly, we need to engage the private sector to expand the delivery of affordable, quality hearing aids and related services. And we need to work with suppliers to enter these underserved markets and, kind of be risk takers. It really is incumbent upon us to ignite innovation, to support provision models that work, and to introduce optimal products into the market at scale in order to meet the unmet need. Secondly, I would like to refer to our work with UNICEF. So I'm so glad Fernando didn't go in to the details of our work together. Because UNICEF has been a really wonderful partner to us. They added hearing aids to their procurement catalogue to ensure that quality products are available globally at very competitive prices. And through this initiative to increase the uptake of the newly added products in low and middle income countries, the impact was really huge. First of all, the price was radically reduced, but also the availability was increased of quality hearing aids that met international standards. When the products were first added to the catalogue, only 200 were ordered. But since then, Dennis tells us that this figure has increased to 16,000 hearing aids. That's impact. Just to give you a little bit of a personal example from South Africa, both my mother and my father, who were in their late 80s, and my husband, who's been in fire services for 35 years and listening to sirens going off, have moderate to severe hearing loss. The cost for a good pair of quality, digitally programmable hearing aids, excluding the cost of the service provision in South Africa, is around 50,000 Rand. So that would be around 2,633 US dollars. That is just unaffordable. If you have a private medical aid, they may contribute up to 10,000 Rand, and you cannot get hearing aids through the public healthcare system if you're on a private medical aid. So it's a little bit of a catch-22 situation. So what lands up being the scenario is that the majority of citizens do not have any access to hearing aids. And Freya and I were talking about the tender in South Africa and how we can change the world and South Africa. So having products in the catalogue was really what afforded UNICEF the opportunity to collaborate with the government of Rwanda to take the first step in realizing their newly approved policy for hearing health, which involved a pilot in 4 districts. Staff were trained and fitting centres were set up, with 1,250 hearing aids procured for the pilot, which was successful. And now for the wow factor. Had the hearing aids not been added to the catalogue and procured through UNICEF, the government of Rwanda would have paid 2,000 US dollars per unit if bought in country, but they were procured at the low cost for the same quality product at 118 US dollars per unit. And I'm pausing for effect there. And of course, there was another benefit that we probably hadn't even considered, that through conducting hearing screening, children with other disabilities, suspected disabilities, were also picked up and could be referred to, the necessary healthcare professionals for diagnosis and intervention. My third and final example of the impact of what works in relation to hearing aid concerns an organization called HearX. They happen to be South African. Maybe I'm a little biased, but they've done excellent work. They are an impact-driven digital health company passionate about affordable access to healthy hearing for everyone, everywhere. They create smart evidence-based tools to provide clinical screening and self-test solutions for easier, more efficient, and cost-effective hearing care. Why? Because we simply don't have, in Africa generally, enough audiologists or speech and language therapists. So at a very practical level, and in fact, Anne has some personal experience of this, HearX's innovative products make it possible for either community health workers or even lay people to facilitate the detection and identification of hearing needs, as well as demonstrate how hearing aids can help, all in one session. This is significant. This is a game changer. Included in the innovative service provision model is the ability to allow customers to try out the hearing aids as part of their diagnostic process in the field so that they can better understand the potential benefits, as well as the use of a mobile phone app that supports their onboarding during the first 6 weeks after they've been fitted. And this is really important because they can then fine-tune and adapt the settings of their hearing aids to suit their unique preferences. And this then improves their hearing ability over a period of time. In 2020, HearX was announced as the 80-20-30 80 Impact Fund's first investment and received grant capital alongside 6 months of venture building support. This investment enabled them to provide hearing aids through a subscription model, a new innovative finance model within Africa, and to also test various distribution models in Kenya to ensure that the product could be accessed by those in need. Is it available in South Africa? No, but that's a discussion for another day. So what did we learn that works? There are innovative ways in which to finance access to AT. That the use of an mHealth WhatsApp or SMS-based hearing aid support program is effective, especially in the first 6 weeks post-fitting of the hearing aids. Awareness levels regarding hearing health and the importance thereof are low in low and middle income countries. And we need extensive awareness and marketing campaigns to change this situation because stigma still exists and we need to break it down. And we also need this awareness raising to ensure that the model becomes sustainable. And finally, I think for me, the most important bit here is that we can diagnose, we can screen for hearing loss, we can fit hearing aids, and we can do all of this at a community level or even just within the home through the use of an app or a phone call with one of the individuals from HearX. So innovative technologies and mobile apps and innovative service delivery models are the way to go. I want to leave this final thought with you as a key takeaway. Through these 3 80-20-30 projects that I've shared with you, it is possible through advocacy, the providing of strategic tools, innovative solutions and service delivery models, and other demand-generating mechanisms to truly change the lives of persons with a hearing loss by giving them access to hearing AT wherever they are. Thank you very much.
Diane, thank you so much. Both of you, that was wonderful. Such powerful stories. And I think, you know, we don't often go through the programme by a specific product narrative or intervention space, and it really does bring home, even to me, the stories that that really make a difference. So we should do more of that. So it comes just to me to close up the session. Maybe we'll have time for 1 or 2 questions, but we will close up quite soon. And just to share kind of what's next. So I guess the first thing to say is, though the 3 of us are standing here today, this is a program that is being delivered in, like I said, more than 40 countries with more than 70 partners, many of whom are not here. So it's a recognition that this only has had any positive impact because it's a multi-partnered effort and continues to be so. And so we'll be taking some time between now and the end of the program that's currently running to redesign the new ways to invest in the most efficient and effective ways possible, learning the lessons of what's worked and building on some of those stories that you've heard. So you'll hear more from us on that soon. But one of the things you should expect, in fact, a few of the things you should expect are more research papers trying to break down the boundaries of what's possible and prove that these new technologies can be adopted safely and well by governments or partners or parties wishing to invest. You should expect more relationships with communities, governments and organisations to share what we've learnt and deliver pilots in countries, in a smaller number of countries, it has to be said, largely across Africa and Asia. You should expect more products like Tiggies and others to be invented and to be able to drive forward change alongside those services delivery models which are changing. More tools and more action to deliver the World Report on Assistive Technology, which completely changed the game this time last year. And you can also expect an Assistive Technology Growth Fund, in which we will invest about half of the investment, because what we've learned is a small-scale investment in companies is not quite what the market needs now to get thousands of products to now millions of people. So we will make larger investments in companies with this new investment in the programme. we think that the growth fund needs to get to about 100 million, and we're putting in about 15. So we're working closely with private sector partners to build the excitement in the space, and we are determined to get to that 100 million, because the companies that want to grow now from reaching thousands to reaching millions need £500,000 to £3 million investment each. So our evidence tells us that £15 million is a lot, but it won't go very far. So we're using it to capitalise those relationships that we have to make a bigger impact. And why? Because this is a way to deliver disability innovation for a fairer world. And we've done a lot, we've learnt a lot, but we mustn't forget that even during this conference, many people have had their lives hindered by a lack of access to disability exclusion or inclusion in its many forms, including a lack of access to assistive technology. So you'll see more proven models of what works replicated in the years to come. You'll see wider market investment capitalised, and you'll see more organisations, governments and cities adopting the ideas that we together have identified as successful. A lot done, a lot learnt, but a lot left to do. And we're really grateful to everyone who is both invested in us, FCDO, thank you again, and also, as importantly, has helped to learn the lessons and deliver the programmes along the journey. Because, without those people, the programme would not simply exist. I will take a couple of questions. And I'm going to start with people who haven't spoken, but if I don't get any, I'll come back. Not that I don't wish to encourage brilliant humans from contributing, because I do. And also, by the way, there's like 80 of you in here, and still you look, quite small for the size of people in the lecture theatre, but you're much more attentive than my usual audience in this room, who are students and are definitely not listening at this point. Questions? Then the floor is yours, sir.
Thank you, Dr. Vicki. Fortunately, she happens to be my supervisor. So I'm actually interested. I must commend the FCDO, the GDI Hub for the innovations that you have done. You have really transformed the AT industry globally, and we have learned a lot from you. My questions, I just focused on the humanitarian space because, I'll say this. I've worked in different contexts, Ethiopia, Somalia, Iraq, and Nigeria. And the need keeps on rising. And now we just have natural disaster in Marrakesh in Morocco. You can imagine the scale of AT needs that will arise as a result of that. Going forward, is there a plan for you to also have an emergency fund that will, from GDI Hub, with the support of FCDO, that will take cognizance of such humanitarian tragedy to address such? Secondly, it's about the partnership. I know the countries where you have piloted some of this work, they are very, very good, but in comparison to others who have more populations, I want you to expand partnership to those other countries. I can vouch for my country because we are looking at that. We are looking at how we can scale up our AT needs in the country. So thank you so much.
And that's Nigeria, just for your information.
I think I can answer a bit of the question, at least, on the humanitarian fund. The grant from FCDO is for research. So we've got, when we spend our money, it must have a research component. So it's not an implementation fund as such, which makes it very difficult to have a humanitarian kind of pot or component, I guess, waiting for a disaster. So, there are some restrictions on what we can and can't do with FCDO funding, unfortunately.
Which is exactly correct. And Kylie mentioned this morning, it was, I know she's flying today, so she must have just sneaked out, but the Ukraine crisis was the first time that WHO were able to formally send a box of assistive technology to a crisis humanitarian setting. So, yeah. So, and she, since this morning when she told us that Morocco were also now being served as well as Sudan, we've also now got another call to serve another disaster that's also current. So it is changing. What we can do as a programme, though, and what we have done and what Professor Maria Kett has led is a piece of work to investigate and research what would need to change in those humanitarian settings in order to make that more possible. And actually, we've provided a bit of support to Kylie and team on thinking about what happens next. We want to follow the box and learn what happens to it. So there's research and innovation thinking about the setting. Also, the use of AI in those contexts is quite an interesting piece that we just had colleagues speak about too. Diane, do you want to add anything?
No, just to say that they've trialled the APL6 and APL10, and I think there's a lot that was learned, and but it's a work stream going forward, both on the research side and the response side.
That's true, actually. So it's the tools that CHI and WHO and GDI and others helped to develop, which were actually used in the context of Ukraine to know what to send. So there are different entry points. I see another question, and I see Fernando. I'm going to go this one first. Every time Anne gets the mic.
Thank you. Hi, I'm Nathaniel Bevan from the FCDO. I was just really a kind of follow-up comment to that, and I wanted to link it up to this point about kind of graveyards of AT as well. I think so. Whilst the research funds we can't use for humanitarian responses, I think one of the things that we are really trying to understand is how to support countries to get better at addressing these crises when they hit. We are understanding what works in these sorts of crises, and this is a problem. An issue for us that goes broader than disability as well. We're very conscious, even during the COVID crisis, of the wrong types of tech getting to the wrong places, and that is very difficult in a crisis. FCDO, we come under pressure, right, to act and to do stuff, but if you look at the kind of warehouses of unused kit and technology. So I think one of the things that we are really keen to use the research to do is, as you say, is to invest in understanding how you can have a more systematic response that enables countries to both identify, request, and implement the right kinds of solutions. Thanks. And while I've got the microphone, also just a massive thank you. It's been really great today. I know we've got more questions to come, but FCDO is really, really proud to be part of this, and it's really nice to be able to just participate in these discussions, right, and have the kind of enthusiasm and energy in here. So sorry, I just wanted to say that whilst I had the microphone. Thanks.
And also for spending the whole day with us. Thank you. Fernando.
Thank you. So I thought I should also mention that UNICEF, as the world's largest humanitarian agency, is very much involved in looking at what can be done and has already done a number of things in the area of humanitarian or contexts and AT. So we have even innovated in things that are not quite as glamorous as digital, such as add-ons to make latrines accessible and usable by persons with disabilities. And we're innovating every day, and one of the things that we are going to do is to preposition a lot of assistive devices so they are ready to go when there is an emergency. One of the challenges, of course, is you can't just go somewhere and say, hey, ship me 500 wheelchairs by the day after tomorrow. Almost nobody has the capacity to. So anyway, so many challenges, and just to let you know that we are going to be in touch.
I feel like I have new friends. And actually, it's really important because, the humanitarian community does work together and it does have good regulations. So Maria advises on disability. So the issue is not so much the commitment, it's more the operationalization of the reality. And I think, so your point about prepositioning becomes then utterly vital in terms of that. Yep. My friend.
I think the question posed by my colleague from Nigeria has to be considered very, very seriously. I want to say that when we experienced the mudslide in Sierra Leone in 2017, we had people who experienced various forms of disability thereafter. So these humanitarian emergencies need urgent support, especially for this AT product that we are talking about. So if we are receiving this massive support from FCDO, I think the component of research must be taken into consideration so that it stands out in the support that we are receiving. So whenever countries, especially countries that you are working with, experience these forms of disasters, then, this support can be provided in order to help our persons acquiring various forms of disabilities. I can tell you that indeed from that mudslide, we had people with various forms of disabilities. And the same goes for all other humanitarian emergencies, the one in Marrakesh. You see countries are sending support now, but 80 products, must definitely stand out, as part of the support that they are providing to this country. So I am definitely passionate about the question that my colleague asked, and I want to say that I'm making this request here that this support that you guys are receiving from FCDO must take this component on board. Thank you very much.
Thank you, sir. That's well made. A comment well made. Doesn't require a response apart from I have first-hand experience of the impact of those mudslides, so 100% understand and agree. I see. I'll take two more. This one and there. I think we have people online and people using the access features. So, and like three more. That's it then. After you.
Hi, Vicki.
Hi.
Thanks for the great talk. I was wondering about the new fund that is coming. Like, do you have the plan for a specific focus initially, or will it be like all assistive technology? Will it be a focus on specific regions initially, or kind of all the regions you work with?
The short answer is we are not yet there in terms of the business plan. So we're working on some market testing with the private sector on investment. If I had to guess, I'd say it probably would be focused on all regions, and it would probably be focused on those areas that are most likely to scale. You might make an assumption about what that might be given the current context and the development of technology at the moment, but we'll be going to market for the business plan development partner and fund operation partner in October.
Cool. All right, thanks.
Hoping to make the first investments in the middle of next year. Actually, September, I think.
Thank you very much. When it comes to solving global issues or coming up with the innovation, the best people who have got the best insight are the people who are going through the problem.
Exactly.
And when it comes to the funding, if the funding are only limited to the educational institutions, how would you incorporate those people insight into this funding? The people who are going through the problems inside into the funding, or they don't exist?
So two things. The funding is coming into GDI Hub, which is a social business based in the UK, but it very much does not stay with us and is distributed across, I think, 70 partners last time in 40 countries. Many of those partners, our team, people who run institutions like this one or lecture in them, like me, have AT needs and are disabled people themselves. So please rest assured that people are well involved in all parts of the process, and the money does absolutely not stay here. Sorry, did I misunderstand your question? Just quickly, and then I'll come to the last one, because I promised people drinks.
It's good. The people you are solving problem for are not based here. Probably they're based in other countries. And you need to incorporate the culture of that country into your solutions. So my question was, how would you get the insight of those people, and how will they be able to take part, be incorporated into the funding? That's what I meant.
Yep, okay, understood.
I'll just say a little bit and then hand over to Diane. But part of the approach of AT 2030 is to work very much with people with disabilities in the context of the country. So if, for example, we were working in Sierra Leone, we would be working with organisations for persons with disabilities and yes. In Sierra Leone, we'd also be talking to individual users, for example, for prosthetics, and talking very much to make the assistive technology context specific. We're trying to learn what works in that context, and there is absolutely no way we can do that without talking to the people that live it every day, to better understand what works, what's going to scale, etc.
And maybe to add that we work with in-country implementation partners and sometimes universities to assist with the wraparound research. So it's really person-centered and contextually relevant.
Thank you.
Thank you, Sam. My name is Ahmed. I'm from Egypt. I want to ask about how can we involve or get the benefit of all resources here, because I think in recent years Egyptian government have started to pay attention to accessibility and consider assistive technology. So I personally have an institution for people with visual impairment. So how can we interact with your network and get the benefit of your research and networks? Is there any other events or can we follow online? Yeah.
Thank you for that question. There was one more, which I think I'll take, and then we'll come back to the panel for a final roundup. There was a woman here with her hand up. No? I imagined the woman with her hand up. Okay. Do you want to go, and then I'll finish up, or does anyone want to go?
Are you going to answer the question?
I can do, or if you want
to. So there's lots of information available online. We have a dedicated website, 802030.org. All our research, influencing papers, case studies, strategic tools, all the work that we do is available there. And there's a search function. It's open access. Also, there is a 802030 Data Insights portal where you can also search on a country and get information around population size, whether perhaps a country capacity assessment or a RATA has been done there, what the population percentage is currently from the last census data. So really lots of information. I would also encourage you to subscribe to our newsletter, and then you'd get all the updates. And have I left anything out? Yeah, and follow us on Twitter, on LinkedIn, Facebook, all over.
And I just wanted to say that it's really I'm really pleased that you want to follow GDI Hub and you're interested, and I think we really need to grow that network. And I know there's a lot of work since the beginning of the project to grow the partnership network and our broader reach. I mean, you said over 60 partners we're working with, and I think I just wanted to add on the AT data portal that Ben has been doing a lot of work in the AT data portal using artificial intelligence to really be able to find out exactly what's going on in a country, who's working there, what work's ongoing, what projects have happened, and as Diane said, a lot of population data and stats that you can use if you're an innovator and want to be more involved.
Thank you. Thank you very much. Thank you so much for your contributions and your wonderful speeches, and to everyone for this test session. We will share more information about the new programme as it starts to take shape, of course. Thanks again to everyone who was involved and the team who've done all the hard work behind both the work and the numbers about the work. And that is where we'll leave it today, I think. Before you